Hello everyone, my name is Brittany and I'm going to be speaking with you a little bit about tuberculosis today. Tuberculosis is also known as TB, and it's a disease caused by a germ called Mycobacterium tuberculosis. It's spread from person to person through the air. It usually affects the lungs, but it can also affect the brain, kidneys, and spine. When a person with infectious TB coughs or sneezes, droplet nuclei containing the germ are expelled into the air, and if inhaled by another individual, they may become infected as well. But not everyone with TB bacteria actually becomes sick. And because of that, there's two different types of tuberculosis. There's latent TB infection and TB disease. People with the latent TB infection, they don't have any symptoms, they don't feel sick, and they are also not infectious, meaning they can't spread it to other people. And of the people with latent TB infection, about 5 to 10% of them actually contract the disease itself. And usually that's people with weakened immune systems, such as people that have HIV, people who are sick, the elderly, people who live in other countries or parts of the world where TB infection is more prevalent and harder to treat as means of access to antibiotics and that type of thing. Of special concern are also people who are infected with the extensively drug-resistant form of TB because it's harder to treat. A person with latent TB infection needs treatment for that latent TB infection so that it prevents TB disease from developing. But if they're exposed to someone who does have that multiple drug-resistant form of TB, it's going to be a lot harder to treat, and it may also not be possible to treat in that latent stages. It really just depends on the person and how severe it is. With some people, the TB bacteria overcome the defenses of the immune system and begin to multiply, resulting in progression of the latent TB infection to TB disease. Some people develop TB disease soon after the infection, while others develop TB disease later and their immune system becomes weak. So it just kind of lays dormant, and then it can activate when there's a lot of stress, or if the immune system becomes weakened, that type of thing will spike it, and then it'll become the TB disease. People with TB disease often experience weight loss, loss of appetite, night sweats, fever, fatigue, chills, coughing with or without blood, and also chest pains. People with TB disease are considered infectious, and they can spread the TB bacteria to other people. If the TB disease is suspected, someone should immediately have a medical evaluation and also be tested for TB with the skin test. And if the skin test does detect that they do in fact have it, they should be treated right away, because if TB disease is not treated, it can cause severe problems, including death. So definitely want to jump on that as soon as possible. As soon as you think you may have been exposed, definitely go get tested. People with the latent TB infection, as mentioned before, they don't have any symptoms and they can't pass the TB bacteria to other people. But if that latent bacteria becomes active in the body and they multiply, the person will go from having latent TB to having TB disease and becoming sick. For that reason, people with latent TB should be treated to prevent developing that TB disease as soon as possible. Treatment of the TB infection should be started as soon as possible. As mentioned before, it would only change if that was the multi-drug resistant form of it, in which additional measures would be needed to be taken to treat that. It's very important for the people that have TB disease to be treated, finish all the medication, take it as prescribed, do exactly as their doctor says, because the moment they stop taking the drugs, they can become sick again. And if they don't take the drugs correctly, the TB bacteria are still alive and they may become resistant to those drugs, which makes it a lot more harder and difficult and expensive to treat the disease. TB disease can be treated by taking several different medications over a period of 6 to 9 months, and patient compliance is key. They need to be taken exactly as prescribed. so they don't get that multi-drug resistance. For the patients with latent TB, their treatment options are a little bit shorter, depending on the type that they have. Medications range from 3 to 4 months, or they can also be the 6 to 9 month one as well. Obviously, the shorter treatment options are going to be optimal because it's a lot higher rate of patient compliance if they only have to take the medications consistently for 3 to 4 months, and opposed to the 6 to 9 months. And that goes as well for treating latent TB and opposed to the TB disease. Because if you're treating the latent TB infection, you're only treating the infection itself. If you're treating the disease, you're also having to treat all of the symptoms that come with it. And you're having to do that 6 to 9 month treatment. So it's going to be a lot easier to treat the latent form of TB. So definitely recommend getting it taken care of as soon as possible, so that you don't become contagious as well and you don't infect other people. It's a lot harder for you to be monitored and treated with TB if you are infectious. And then again, in 2007, a patient who was infected with an extremely drug-resistant form of TB refused to follow doctor's orders and flew out on an airplane. Because of that, he was legally confined. And since then, other patients with the XDR TB have been subjected to legal confinement in hospital jail units. In my opinion, I would honestly say that that's completely ethical. Technically, it is taking away the rights of that specific individual. But by doing this, you could be saving hundreds, if not more, of lives. This is no different, in my opinion, than the mandatory self-quarantines that we're having right now in the global pandemic of COVID-19. We have these going around all over the country, all over the world, mandatory quarantines. If you are sick with COVID-19, or if you're exposed to someone, you have to stay home. You can't leave the house. We haven't gone as far as jailing people that I'm aware of, at least in this country. But I would still say that it is definitely ethical and overall the best option, because if you're infected with a deadly disease, your respiratory system could be considered a deadly weapon. And because of that, you should be confined with or without your consent so that you don't kill many innocent lives. So definitely just stay inside, self-quarantine if you think you may have been infected to any serious illness that could be passed on to other people. I hope you all enjoyed my video. Bye.